Thank you all for attending this national learning event hosted by Healthcare Improvement Scotland. Unfortunately, I cannot be there with you today, but I look forward to hearing about the insights from today's discussions. Events like these are crucial, providing a space for all those involved in primary care to come together, share learning, and strengthen our collective approach. By networking and discussing best practice, we can build on our successes, address challenges head on, and ultimately ensure that Scotland's primary care services continue to evolve in a way that best serves our communities. First of all, let me say that I know you are all continuing to operate in a challenging financial and delivery environment, and you have my utmost thanks. Many of you will have heard the First Minister's speech where he reiterated our commitment to protect, strengthen, and renew our National Health Service in Scotland. It is in this context that primary care and general practice have never been more important. It is at the heart of our ambition to shift the balance of care away from acute hospital settings and into the community. That means investing in primary care and ensuring that our workforce is supported to deliver high quality care. It also means ensuring that our approach is evidence-based, shaped by learning and experience, and continually improving to meet the evolving needs of patients. We know that when people can access the right care in the right place at the right time, outcomes improve, not only for individual patients, but for the health service as a whole. Multidisciplinary teams are an integral part of our approach, ensuring that patients can access the right expertise without always needing to see a GP first. This not only improves patient access, but also helps alleviate the workload on GPs, allowing them to focus on more complex cases. This brings me to the primary care phased investment programme, which is so important. It is an example of the collaboration between different stakeholders, providing the evidence base for how we can implement that kind of approach. I've also had the privilege of seeing this work in action, most recently in Edinburgh, where I witnessed firsthand the impact of multidisciplinary teams working in general practice. This programme is fundamental to how we assess the impact of the MDT working, which will then inform and support future long-term investment in general practice. Of course, the phased investment programme is just one component of a much wider programme of work around multidisciplinary team delivery that is happening across Scotland through the primary care improvement plans. If you haven't already, I would encourage you to find out more about the National Primary Care Collaborative that is offering support to all areas to implement quality improvement approaches in pharmacotherapy, CTAC services, and in access to primary care services. And in turn, all of the work around multidisciplinary team implementation is taking place in a much wider primary care reform landscape, and I understand you will hear more from colleagues on that later in the day. So let me just reiterate once again that events like this are vital in driving progress forward, and I want to thank each of you for your dedication and contribution. Ultimately, our goal is simple: to ensure that Scotland's primary care services are resilient, responsive, and capable of delivering the best possible outcomes for patients. The work that you do day in, day out makes a real difference in the lives of people across the country, and I want to express my gratitude for your efforts once again. I look forward to hearing more about the discussions and the insights that emerge from today's event, and together, by sharing knowledge and working collaboratively, we can continue to strengthen primary care and build a healthier Scotland for all. Thank you.